Hello. In this module, the term persons living with dementia will be used to emphasize that dementia is a diagnosis and does not define who a person is. Dementia is highly stigmatized as a disease process. The term persons living with dementia is used to promote positive language and a more person-centered approach. Welcome to the education module, Nonpharmacological Interventions for Dementia-Induced Psychosis. Nonpharmacological means any type of intervention or strategy that is not primarily based on a medication or a drug. Some examples are physical activity, nutrition, and sleep. The purpose of this module is to discuss some of the non-pharmacologic interventions that can be used with individuals experiencing the neuropsychiatric syndrome of psychosis while living with dementia. Non-pharmacologic interventions, or NPIs, are different actions, strategies, or therapies that are adjunctive to, meaning in addition to or with, and do not involve drugs or medication. Adjunctive means something added in addition to. For this module, the person living with dementia is most likely taking a healthcare provider prescribed medication, but the caregiver is adding the non-pharm interventions to help control the symptoms of psychosis. So what do NPIs do? NPIs slow the spread of community illnesses like COVID-19 and the flu. They act as community mitigation interventions. Mitigation is the reduction of something harmful or decreasing something like a virus or a bacteria or environmental pollution to reduce the harmful effects that are positive to all living things. Or like staying home from school or work when you're not feeling well, then you are trying to mitigate that your illness will not spread to other people. Make sense? NPIs are a form of a risk management plan. Think about the plan that you have for your family if a fire or tornado or a hurricane occurs. Risk is all around us. That is why healthcare focus is placed on mitigating risk in order to keep patients and staff safe. It's important, however, to keep in mind that it's impossible to eliminate risk completely, but any effort put towards mitigation can be tremendously positive for all involved. NPIs are sometimes referred to as complementary or alternative interventions. These can be self-directed or self-administered. And it's very exciting for the caregiver to be able to do things that are not related to drugs with the person that can help their symptoms. NPIs can enhance the person living with dementia's quality of life and also the caregivers. NPIs can decrease the number and intensity of dementia-related psychosis symptoms that generally lead to emergency department visits and hospitalizations. NPIs can decrease pain and perhaps more importantly, decrease strain and illness in caregivers. So what are the variety of types of NPIs? Distraction is taking the person's attention from what is causing an issue to something more pleasant. Not arguing and changing the subject is a good intervention. Showing that something they might be more interested in is also very good. Even going to a different room is a good distractor. Stress management can include guided imagery, relaxation techniques like deep breathing, gentle movement such as Tai Chi, and massage or physical therapy. Depending on what the person enjoys, you can try art, things like coloring, pencils, drawing, building, sculpting, all sorts of different things. Music, but what they like. Music can help increase energy levels and improve everyone's mood. It may help reduce pain by triggering the body to release endorphins that are natural body chemicals that decrease pain. Music may be used with any of the other techniques, such as relaxation and distraction. You can read books or articles from magazines out loud and make sure the subject is something that the person living with dementia would enjoy. This is a great intervention to do once in bed and ready for the person with dementia to go to sleep. It's very relaxing. Pets are incredibly therapeutic and can be any type of living thing the person enjoys. The act of petting an animal's fur helps to distract and relax the individual. Or even if they don't have fur, and they might be a lizard or a turtle or a tortoise, that still gives a person joy. Physical therapy or occupational therapy may need a referral, but sometimes the movements of joints is an important aspect. They can be gently done by a caregiver as well, such as moving the hands and feet very slowly. Types of NPIs need to be meaningful. Meaningful activities include any physical, social, spiritual, or leisure activities that are individualized to the person's needs and their preferences. What do they enjoy? Participating in meaningful activities helps them feel good and that feeling supported, and they can have some independence, and it gives purpose to their lives and yours. When the person living with dementia and you work together, you will discover many ways to support engagement and the ability to enjoy every moment together. Deep breathing can help a person relax and even decrease pain if that is a symptom. Get packs that can be cold or warm and put them on a spot that might be bothersome to the person, but never hot and never directly on the skin. Use a washcloth or a dish towel or something between the pack and their skin. Support groups are a wonderful way to interact with others who are living with or caring for a person living with dementia. You can contact your local area agency on aging office or the Alzheimer's Association state office to ask about support groups that are available in your region. Aromatherapy is a way of using scents to relax and decrease pain. Aromatherapy uses oils, extracts, or fragrances from flower, herbs, and trees. They may be inhaled. They may be done with facials, body wraps, or baths. Remember, though, just as a caution, it's important to know some of the ingredients in oils can interact with medications. Also, there is a shelf life for these products. Cooking is also a wonderful form of aromatherapy. What do you remember smelling when you were growing up that made you happy? Popcorn, gingerbread, cookies, coffee, making bread. These are all wonderful smells that can go throughout the house and actually help the person. Meditation and chair yoga may help your mind and body relax, and you can do this with the person living with dementia. This can increase feelings of wellness. Meditation and chair yoga also help distract the person living with dementia or take focus off of pain that they may be experiencing. Validation therapy is a way to approach the person with empathy, understanding, dignity, and respect. It is often used to comfort and reassure the person living with dementia. Validation therapy may help people with dementia become more communicative and less withdrawn and improve their sense of humor. These improvements, in turn, can reduce stress for caregivers. The most important part of therapy is listening. By listening attentively and responding respectfully, You validate the person with dementia by showing your willingness to enter their world rather than trying to force them to be within yours. Reminiscence therapy, you can use photographs, albums, familiar things from the past, music, and movies. These help to evoke the long held memories or things that are personally important to the person living with dementia. And it's very helpful. Physical activity should be catered to the individual's functional ability. Increasing activity helps with many issues related to dementia. Problems in the physical surroundings and environment of the person in their home or residential care facility can cause or exacerbate restlessness, frustration, anxiety, and disorientation. Changes that you can do include reducing level of noise and negative distractions, setting a comfortable temperature in the room, and consider the individual's proximity to heaters or cold drafts. Ensure adequate lighting, avoiding glare from artificial light or sunlight, using labels and memory aids, ensuring easy access to the bathroom. Regular prompting can help remind a person that they used to need the toilet, or signage may be appropriate. Provide privacy and avoid overcrowding or clutter. Have a prominent clock, calendar, and daily schedule visible to improve orientation. Have personal belongings around and have constant caregivers. That really helps the person living with dementia. NPIs should be considered before drugs. NPIs encompass a holistic approach that thinks about the psychosocial, spiritual, cultural, and environmental aspects of the unique person with dementia. So in summary, NPIs are individualized to the person. Even though many people are diagnosed with psychosis and dementia, they are all unique with their own history and life experience. What works today may not work tomorrow. There are no recipes to follow. Just keep trying to offer interventions to the person and hope for a positive response. What doesn't work, write down and don't try again. Make sure others know what not to do. Words stick. Whatever works, stick with it and enhance it. Remember, dementia is a disease of the brain that is progressive. Do not take things personally. I know that is difficult, but there is always hope. New NPIs and even medication are being researched all the time. And even one good day is a win-win for you and the person living with dementia. So we thank you. And if you are interested, there is a series of neuropsychiatric syndromes of dementia that you might want to participate in. Thank you for your time.